What is the purpose of the Bayley Scales? Have you ever wondered how professionals assess the development of young children? The Bayley Scales of infant and toddler development play a key role in this process. So, what exactly is their purpose? These scales are designed to assess and identify developmental delays in children from infancy up to 3.5 years old. They evaluate several areas of early development, providing a complete picture of a child's functioning. This information is essential for planning early interventions. The Bayley Scales focus on 5 main developmental domains. First, there are cognitive skills. This domain looks at problem-solving, memory, and reasoning abilities. Next, we have language skills, which include both receptive language, or understanding communication, and expressive language, or using words to communicate. Motor skills are another important area. This includes fine motor skills, like grasping small objects, and gross motor skills, such as crawling or walking. The 4th domain is social-emotional development. This assesses how a child manages emotions and interacts socially. Lastly, adaptive behavior covers practical daily living skills, including self-care and social abilities. The assessment process involves both direct testing of the child and input from caregivers. This combination makes the Bayley Scales a well-rounded evaluation tool. In the context of autism spectrum disorder, the Bayley Scales are particularly useful for early identification of developmental differences. They help detect delays in communication, social interaction, and cognitive functioning, which are often seen in children with autism spectrum disorder. The results from the Bayley Scales can inform diagnostic decisions. They help professionals tailor intervention strategies to meet the specific needs of each child. For example, scores in language and cognitive areas can predict later functioning levels. This information guides therapists and educators in planning the right support. While the Bayley Scales do not diagnose autism spectrum disorder on their own, they are a vital part of the diagnostic process. They highlight areas where a child may be behind typical developmental milestones. Early use of the Bayley Scales supports timely intervention, which is essential for improving outcomes in children with autism spectrum disorder. In summary, the purpose of the Bayley Scales is to provide a detailed measure of early childhood development. They identify delays or atypical patterns and support early diagnosis and intervention planning, especially for developmental disorders like autism spectrum disorder.